The most vivid photographs of Susan Birch are those taken on her various trips to Uganda, where as co-director of the Global Institute, she leads teams of volunteers working with women and children in the slums of Kampala. But she calls that a hobby. Her life's work of nursing was decided at an early age, at the knee of her mother.
My mom is an amazing woman, and my grandmother was really very ill, and so over the years of caring for her at home, kind of before the hospice years, there was just a culture of caring and nursing and just nurturing. So it really laid the grounds for getting into healthcare.
Birch studied at the University of Colorado, first for her nurse practitioner degree and later an MBA. In 1995, she became CEO of the Northwest Colorado Visiting Nurse Association.
It's a little agency that spans 10,000 square miles with 150 care workers, and now they've got a budget of about $9–10 million, but we grew the organization in the 90s and through the 2000s into an incredible integrated service delivery model for rural health care.
During her tenure at the Northwest Colorado VNA, Birch forged innovative partnerships, expanded home health and the Nurse Family Partnership Program. Through another program called Aging Well, 10 Colorado communities are participating in community-based solutions and demonstrating that managing chronic disease saves healthcare dollars. More recently, tapped by Governor John Hickenlooper for his transition team and then his cabinet, Susan Birch now leads the state's Department of Healthcare Policy and Financing, and says her years in the northwest corner of Colorado give her the framework.
We have this moment in time with healthcare reform to really build an incredible foundation and move healthcare forward for the state of Colorado so that all of our citizens will have cost-effective care. The department's going to be moving in some new directions. We need to get people focusing on their health and their assets and their good attributes, and we need to work with them on some of their chronic diseases and problems. And we also need to work on our built environment and make sure that we've got trails and rec centers and the right kind of health facilities that are not so expensive but will help people stay healthy.